Hi, I am Sakshi and I will be providing a brief introduction on what our report is based on. So, in this report, we use various data mining techniques in order to analyze the data set predicting heat strokes. The various data mining techniques used for this data set are data preprocessing, data cleaning and reduction, data transformation, data discretization, classification, decision tree analysis, 1R, naive Bayes, and IBK. Lastly, we will analyze the results, which will provide a clear-cut solution. So basically, a stroke occurs when the blood supply to a part of a brain is interrupted, cut off, or reduced. This prevents the tissues in the brain from receiving oxygen and nutrients, which causes the cells to die within a few minutes. Stroke is a medical emergency and timely treatment is essential. According to reports from the WHO, strokes place second for the causes of death globally. Overall, it counts for 11% of deaths. Therefore, with the help of this data set, we will be able to understand if the predictions of whether a patient is likely to get a stroke is accurate. So, with the help of decision-making system along with the knowledge obtained from physicians and their experience, strokes can be predicted by identifying high-risk patients and necessary changes can be made to their lifestyle in order to prevent the risk of getting a stroke. It is estimated that if these patients can be identified, 65 to 85% of strokes can be prevented. This will help in providing more opportunities for a well-informed healthcare as well as help in preventing several deaths caused due to stroke.
Hello, sir. My name is Wanathan Zain and I am from Myanmar. I'm going to talk about dataset description today. And we obtained the data from Kaggle website. As we chose this dataset because it is well organized and quantity of records is sizable and applicable for many purposes. And the data is made up of over 5,110 records with 12 attributes, ensuring that data of appropriate site can be mined. Each instance is classified as a quality attribute, and the dataset comprises information on patient such as gender, age, various diseases, and smoking status who may suffer a stroke depending on the input parameter. In BMI, there are also some missing values, and it has also a high error, which is not conducive to obtain an accurate representative of the dataset. So we remove some of the attributes for mining task.
Hi, my name is Anjulin and I will be presenting about the data preprocessing and data mining techniques. Before we actually start applying any sort of data mining methods or algorithms through this dataset, we did a preprocessing to avoid noises in our dataset such as redundancy and consistency in value or attribute. Irrelevant data and incomplete or missing values that can cause inaccuracy in final result or the process of data mining. There are a lot of preprocessing methods with different purposes, but in our case, we use data cleaning, data reduction, data transformation, and data discretization. As the name suggests, data cleaning and data reduction includes the process of removing instances and deleting data columns that are protected, irrelevant, or missing. In the data transformation, some of the data types were changed from numerical values of 1 to 0 to Boolean values to fit the needs of algorithm that we are going to use. Some numerical values of each column contains alternating values such as 0.8 and 0.41. So they were all rounded up and put into excess of ranges starting from 1 to 80, which is known as discretization. After all this data processing, we still had a problem with our dataset, specifically the instance being arranged in a biased order. So we took the extra step to solve it by using the render function in Excel and rearranging them. In data mining classification, we have decision tree analysis, 1R classification, naive Bayes, and IBK. So for the decision tree analysis, it is used to classify different applications and perform accurate results of the classification results. And also the J48 algorithm is one of the most commonly used machine learning algorithms that can classify and continually check data for the 1R classification. It provides to be a simple classification algorithm and not as accurate as modern classification algorithm. Therefore, it can create simple rules for humans and a way to find very easy classification rule for life-based. It is a probabilistic classification and is easy to implement. It is also considered to be a classification algorithm which can even outperform very complete classification methods for the IBK. It used the distance method to locate instead in the training data for each test and use the select instance to make prediction.
My name is Steven, and this is a summary of the results produced by the 4 classification algorithms that we used as mentioned just now. As you can see from the table, there are a lot of true positive results, over 3,300 for most algorithms, and most of the accuracies are above 90%. The J48 and naive Bayes models have more true negative results than the other two. However, they also have higher false negative results, which means the patients that are actually positive would be incorrectly identified as negative, which would be dangerous for the patients. Overall, the 1R algorithm has the highest accuracy. However, the results also contain undefined values represented as question marks as shown in the image. Therefore, we chose IBK as it has the second highest accuracy. The recommendations for further data mining on predicting strokes are that we could use more instances, an unbiased dataset, more accurate and reliable data, as well as different classification algorithms. These are the reference links for our presentation, and thank you for listening.